what we should do if somebody has, or we have to identify the disease, or if the population, the first and foremost thing is we should assess what is the disease burden. So screening, we used to identify that. What is the number of people who are affected by these diseases? When I say I'm combining all the 8,000 diseases together, and we should look at for each of those diseases. What is the health outcome? Whether it is something very serious, or it is where the mortality is very high. So like that, we'll have to look at the health outcomes. Not only look at health outcome, we should also look at the quality of life, whether how it is affecting their quality of life, and the healthcare use, and what is the economic cost. So these things we'll have to look into when we are trying to assess the burden of the disease. Okay. The second thing, as public health people, we have to look on to prevention. So if we have to look on prevention, we should know what are the preventive methods. And for that, we should do research, because these are all diseases which not much studies have been done. So we should focus on the research, especially the cause, how the treatment can be done, and how it can be prevented. So for that, research is necessary. The next important thing from a public health point of view, what we should look at is the early identification. Early identification is that we should not only screen the disease. We should, as I said, screening everybody is not possible, but for certain diseases, depending on the prevalence in the respective countries or the state, they can screen for those which the prevalence percentage is little higher than the others. Okay, so early identification can be done. So when we work in public health, it is, I generally talk, it is for the public, by the public, and to the public, like what we had our slogans before. So we should empower our people or our public in identifying, or at least not just sitting at home with, if there are certain symptoms, saying that this is very common, it is there from so many years and all. So if they find something, they should be able to go. So we should educate people in such a way that they will get some kind of a doubt, oh, this is not normal, this is something abnormal, I should go, especially with the families, if they find some genetic disorder or something like that, and go to the treatment, or go and meet their doctors, okay, the physicians. And we should also empower and educate the physicians, because they generally ignore it because of ignorance. So we should also educate them about rare diseases, not only those diseases which are very common in their place. We should also have policies, the government policies for this. Thankfully, Government of India in the year 2021, they have come out with a national policy for rare diseases. Okay. And if when rare disease policy was asked, people were not having, they did not have any clue. So they formed a committee, and the committee is looking at it, how, what all can be done, and how the policy can be drafted, and all those things. And in 2021, they came out with a policy. Anything what we do in public health, we give most importance to the prevention. So we can do primary prevention, secondary prevention, and tertiary prevention. So in primary prevention, what we do, we should be able to identify what is the cause. And once we identify the cause, we will be able to plan the strategies for the treatment. So some of the techniques what we can use to identify, or the we can do primary prevention, is by screening prenatal. When they are pregnant itself, we should screen for some genetic disorders for the infants. Not only it is before the delivery, in prenatal period, we should also look at postnatal. Okay, some diseases, the child will be born normal, but later they may get affected. So it can be even during the postpartum period, postnatal period, or maybe a little later also. So if we are able to identify them early, so we'll be able to do primary prevention. So what is the secondary prevention then? Secondary prevention is usually screening and early identification. So if we identify them early, we will be able to prevent them from going for further complications. Tertiary prevention is rehabilitation. Suppose they have some disease which is debilitating and they have become disabled. So we need to do some kind of rehabilitation and provide them some kind of a supplementary services, what is necessary. So these are some of the public health perspective and how we can work on rare diseases. And the other one is basically about the research which I already told about. So as I said, Government of India already has a national program and how it can be integrated into the National Health Mission. So the primary prevention is it's part of the reproductive health. So we can do family planning program, Pradhan Mantri Suraksha Maitritva Abhiyan. So like this, Janani Suraksha Yojana, Rashtriya Bal Kalyan Karyakram. So we can use all these programs to identify the disease as early as possible and prevent. So it can, whether it can be primary prevention, secondary prevention, or something like that. So now we have newborn care also. So the newborn care, as soon as the child is born, they can identify some of the diseases. Okay, or Rashtriya Bal Suraksha Karyakram, they are able to screen some of the school children and identify some diseases which are there. Okay, so like this, a lot can be done in terms of prevent from the public health point of view. I told you about primary prevention. So what is primary prevention in rare diseases? So here, basically, we are looking at preventing the occurrence of the disease. So now suppose, for example, we have a family or an individual who have repeatedly had some kind of genetic issues. So then we prevent the birth of that affected child. So we use various techniques, or we can use we can go for abortion or something kind of a thing. Now, how do you do identifying itself? So you can use this amniocentesis or some scan or some other method, device where early detection in the prenatal period itself we can do. Though it is not completely feasible, but yes, for high risk population, we can do these kind of screening technique can be used. Now, secondary prevention, here the strategy is to avoid the birth of the affected fetus. For that, we are using early detections. Okay. So then we can do some, if you identify them, then you can do some kind of medical intervention. So now we have a lot of technologies improved. So genetic diseases, some of them can be modified. I'm telling some of them, at least to a little bit, but if not more, research is still going on. If we can do some genetic modification and change these diseases. So tertiary prevention, when we come to this here, we should be able to provide good care and rehabilitation for those who have gone or who have already into advanced stages of these diseases. Okay, so here you provide some kind of a support. Now, we saw what is the disease. We saw how, what is the burden of the disease. Then what are the challenges? Okay, and then we saw how do we diagnose or identify with. And then we looked at, from the public health point of view, what can be done in this rare disease. The most important of all in public health, I would say, is awareness building, the capacity building, both to the population and to the healthcare providers. Now, looking at all these burden, disease burden and complications in this, the UN came recognized the importance of rare diseases, and they adopted a resolution, and they're promoting the same resolution, which in part of the sustainable development goals. So what they said, the UN agenda in advancing UN's commitment in achieving the 2030 sustainable development goals. So they have taken this stance on leaving no one behind. So that means even those who have rare diseases, we have to take them forward. So we cannot just ignore them. So what are their policies? They say social inclusion and participation of rare disease patients and families. So they should not be isolated. They should be included, in everything. So there should not be any stigma as such or something like that. The next resolution is that universal equitable access to quality of care. That means whether they are rich, poor, or in the middle income population, everybody should have equitable access to this particular diagnosis and care. Okay, even those who do not have money, everybody should have equitable access to this. That's the second policy of UN. The third one is promotion of this rare disease strategies and action at the national level. So the UN will keep pushing the government to form policies if they don't have, and then start working. And they're also looking at how do we integrate this particular screening or working for the rare diseases in any other UN programs and agencies, and also give some priorities for this. Okay. So the UN has also decided to routinely publish some materials on this particular disease, especially monitoring. So it's India in the year 2021, they accepted the national policy for rare diseases. So what they do, they are categorizing, there are a lot of points in this rare diseases in as per the national policy. They speak about what is the rare disease, how do you categorize them? So they categorize as group 1, group 2, and group 3. And then not only that, they also help in diagnosis. They are the main point in government, even though this is a state subject, health is a state subject, it's a national issue. So they support. So not only the government supports for identification and treatment, they also support in some kind of, financial assistance for these people. So one example is they can get financial assistance up to 20 lakh under Rashtriya Arogya Nidhi umbrella scheme. Okay. So, and there is no discrimination whether they are BPL or APL. Okay, so they should get the beneficial of the policy. If the government is not able to provide, they also have a policy of crowdfunding. Okay, people can raise funds from corporates or HNIs or somebody like that, so they can do. Not only it talks about this, it also talks about starting new center of excellence. So they have identified few higher educational institutions or higher health institutions which provide tertiary care, and they are helping them financially and also in terms of technical knowledge. Okay, so then the policy also talks about how do we prevent, how do we reach the community, how do we do the diagnosis. So like that, there are a lot of points which are present in the National Policy for Rare Diseases 2021. So now we came across the what is the disease to how do we treat and how do we prevent about rare disease. Okay, so I'm reiterating again, it is because it is rare, we neglect it. So I think it's a time now that we should not neglect. COVID has given us good lesson that even if it is rare, we should not neglect it. We should focus on all the disease, give importance. If not the entire healthcare family or healthcare professional work, at least few of them should work on these particular rare diseases.